If you are a huge company that's reliant on your stocks, and if you have the opportunity to work with some scientists on developing something to put in the bag of food that makes it more addictive, then you're gonna do it.
In America, we've lost the art of medicine, but we're finding our way back. Dr. Clay Moss is a physical medicine and rehabilitation physician who's built a following of over 450,000 people by saying what most doctors won't.
If they can learn how to cook their own food, that's rule number one.
That our healthcare system treats symptoms, not people, and that we, the people, have the most control over our future health.
The best possible prescription that you could give somebody from a nutrition standpoint is sustainability.
Dr. Moss believes that strength is medicine, that your muscle mass determines your health and your future independence, that the last decade of your life is being decided right now, every day, in the choices we make and the habits we form.
We all get into this trap of really chasing a retirement without actually preparing for it physically and mentally. We're just preparing for it financially, and I see it every day.
In this conversation with Dr. Moss, we discuss why modern medicine has failed us, the biomarkers that actually predict your future health, and exactly how to train, eat, and live to extend your health span. This isn't about living longer, it's about living stronger. Welcome to Stronger Weekly, Dr. Clay Moss. This is, so two firsts for me. One, I've never actually trained with someone that comes on the show.
Yeah.
I told you that earlier before.
Yeah.
And I've never trained that hard where we're both sitting here coughing from a high intensity workout.
Yeah, we're gonna have to cut some noises out for sure.
We'll edit it out.
Yeah.
Are you recovered enough?
I would say 70% recovered. Yeah.
All right. Well,
30% faking it.
I'm right there with you.
Yeah.
So we might edit out some coughs, dude. So let's start with, I was going to ask you offline, but I want you to explain, because a lot of people don't know what PM&R is, right? So Physical Medicine and Rehabilitation, which is you're in residency for that
Right.
specialty. Give me an overview of what that is so people understand.
Yeah, so I actually didn't know it either. So it's the traditional route, like you go to medical school. Initially, I was actually interested in doing plastic surgery or orthopedics or something like that. And I got to second, third year of med school and realized that I didn't really love being in the OR that much. I thought that it was just gonna be this glorious thing, and I wasn't really talking to patients very much. I didn't really get to actually have conversations with them about their lifestyle, their diet, things that we'll get into obviously. And so I approached my mentor at the time, who was this Harvard-trained genius plastic surgeon, and was like, look, I'm having a little bit of an identity crisis. I've been telling myself for 10, 15 years that I want to do this one thing, and I realize that I don't want to do that anymore. What do I do? And he was like, oh, if I actually went back, first of all, humility, biggest lack. There's a huge deficiency in humility in medicine, and this man changed the course of my life because he had some. And he said, if I had to go back and do something different, I would not have gone into plastic surgery, and I would have done PM&R. And I was like, I don't know what the heck that is. So he hooked me up with a couple of people, and I ended up falling in love with it. And what it is, so PM&R stands for Physical Medicine and Rehabilitation. It's also referred to as physiatry. It's also referred to as physical medicine rehab. There's so many different names.
Got to make it complicated.
It's very complicated. And the stigma is that PM&R doctors tend to be very chill, nice human beings. And I think part of that is because there's so much humility in having to tell people what you do every single time they ask. So,
Right.
So there's not a lot of ego in that front. But how it came about is actually in World War I, we had all of these troops coming back from the war with these complex injuries. And so we wanted to have physician-led rehabilitation programs, whether it be from spinal cord injury, brain injury, amputations. So it started off as that. And then it garnered a little bit of attention there. It didn't really take off. FDR ended up getting what we thought at that point was polio. And now, actually, if you look back, it was probably something like transverse myelitis or Guillain-Barré syndrome, which is a discussion in itself. But the rehab front really came into importance at that point because, the leader of the free world had something that we needed to help him become more able to do activities of daily living. And then World War II is where it really took off because obviously much more involved. Everything from the artillery just to the weapons and the injuries were so much more complex. And so we really needed physicians to kind of head up that front of rehabbing our soldiers when they came back from the war and being able to deal with them from a medical standpoint, and also just oversee the wonderful men and women that were, in physical therapy, occupational therapy, speech therapy, kind of being the quarterback of it all and having a bird's eye view to put together a good rehab plan. So that's where it all took off. The reason why I really fell in love with it, I actually hated it at first. I didn't really love my first couple of rotations, I did spinal cord injury, which is amazing. And there's so many wonderful people that are just great with that. And it's just not what I fell in love with and not my passion. So at first I was turned off, like, oh, maybe it's not my career path. And then I got into some brain injury stuff, and I actually liked that a little bit more. I started doing general rehab on the inpatient front, which is a lot of amputations, knee replacements, trying to get people back to where they were before, if not better. And then there's a whole aspect of the outpatient side, which is a lot of interventional sports medicine. So you're dealing with athletes or just weekend warriors doing things like stem cells, PRP injections.
Wide range of different types of patients.
It was like going into medical school again, which was fun for me because I didn't know what I wanted to do. And so I was like, all right, let's have 4 more years of not knowing what I want to do.
Buy yourself some time.
Right. I think there was a little bit of an addiction for school there. I fell in love with that. Kind of concurrently with that, I had this whole side of my life where I was really interested in human performance ever since I was a kid. I grew up around the Andrews Institute in Pensacola, which some people might know that was, and still is to an extent, like the pinnacle of sports medicine. Like I was 8 years old, walking home from school and looking kind of through the cracks of this place and seeing Shaquille O'Neal, rehabbing his knee, or Tim Tebow getting ready for the NFL draft, or Sam Bradford. I mean, all of these.
I could see how that'd be exciting.
Kenny Chesney, like all of these.
Kenny Chesney?
Right, yeah.
I see that coming.
Justin Timberlake, like people that weren't even athletes that just wanted to go there because it was the mecca of, if you get something done, let's get rehabbed quickly. Funny looking back at it now, I thought that was a completely orthopedics institute, and PM&R actually plays a huge role into that, especially on the non-operative side, or even after they have their operation. You can do things like injections or whatever, or medical management in order to get people back to where they need to be. All of that to say, I had this whole side of my life where I'm interested in not only optimizing myself, but also just a nerd about, supplementation and telling my friends about it and trying to get them to do better for themselves. Even selfishly, like I just think that I'm OCD like that, and I want everyone around me to be optimizing themselves as much as possible, even though they might not be as passionate about it as me. And so PM&R has kind of found its way to be this means to an end for me to get to like what you would call this functional medicine, regenerative medicine, longevity style practice that I'm going to go into once I finish training next year.
Where do they commonly work? Because which is a broad range of different people that they help. What is the career path, and where would you find one working?
So inpatient rehab has actually taken off. It's one of the very few things in medicine that has garnered more dollars rather than less. Like a lot of things are getting slashed and cut for reimbursement rates. Rehab's one of those that stayed pretty stable because we have an aging population, and we're going to continue to see that. So there's a lot of ways. First one being the traditional inpatient side. So you get in a car accident, you have a traumatic brain injury, you have a spinal cord injury, whatever. You're in that hospital, you get medically stabilized. And once you're stabilized, then you have the option to go somewhere after that. The highest level facility would be inpatient rehab. So you can do inpatient rehab at a standalone hospital, where you basically go to that next step where you're still getting eyes on you from a medical management side, but you're also doing 3 hours of therapy every single day, whether that be PT, physical therapy, occupational therapy.
That was my next question. So that's where, bring it all together for me, because when I think of like, say, acute rehab center, I think of occupational therapist, physical therapist. Is the PM&R, got it? Are they like the quarterback of the care plan amongst that whole team? That's essentially what it looks like?
Exactly.
Okay, that helps.
Yeah. And also, there's so much, other than that group, there's so much else that goes into it. The nursing care team, the case manager who kind of deals with how is this patient going to go home? Like, do they live in a 2-story house with 17 steps to get into the home and a shower that you have to step inside of a tub with no railings? Like, it's not only dealing with a patient from the inpatient side, but also like what the heck is going to happen to them when they go home back to their normal life.
Yeah, so when I was in junior college, I worked as a PT tech. And I didn't know when I started working that I was going to be working with occupational therapists. Frankly, I didn't know what that was.
Right.
And some of the most profound memories of that job was working with stroke patients. And I can remember part of their treatment, for lack of a better word, was teaching this man how to use his dominant hand to eat cereal again.
Yeah.
And it was like emotional to see these people struggling to do like their daily activities. And it opened my eyes. And I was only there for a year, but it opened my eyes briefly to like the meaningful work that happens in these like rehab places. But I think occupational therapy is one that, speaking from my own experience, people don't understand that.
No.
Especially stroke and people coming back from those types of injuries or sicknesses.
If you go follow an occupational therapist or PT or speech teaching somebody how to pronounce words again, you realize the true meaning of the statement, you have a million problems until you get sick, and then you have one.
Right. And it brings color for me when hearing you say, like, you consider being a surgeon.
Yeah.
And I don't know what it's like to be a surgeon, but what I envision is you read a board, there's a patient, you're going to go in, scrub up, you don't even meet the person, you do your specialty, which is obviously needed and meaningful,
100%.
but then you don't get to see the impact.
Right.
So it makes sense to me where maybe, I don't know, you tell me, but maybe you realize that and the human in you wanted to have more of like a tangible impact.
Yeah. Well, I think there's two sides of the story. One, I think that's the case too, and we'll touch on that. The second one is I still like being procedural and using my hands. And so PM&R actually has, on that outpatient sports side, I talked about ultrasound guided injections, but you can also go into interventional pain medicine, not the type of pain management that, is prescribing opioids that gets a really bad rap, which you can, and I would not, but also doing 15 to 45 minute OR procedures on patient spines, right? Like you're going in and you can
you still get to do that.
For sure. I mean, we go through neurosurgery during our residency training just to have that heightened level of experience there. So I still like using my hands. So I liked that. But you're 100% right. Like I didn't love the thought of not spending a lot of time with the patients. And that's compounded by the fact that, if you're in the traditional healthcare system, you're only spending 20% of that time with the patients anyways. The other 80% is done on a chart in front of a computer screen. The difference is that now, from not going to surgery, I can focus on the area of medicine that I think needs the most help. I think we are by far the best in the world at treating acute conditions. The United States is by far, if you get in a car accident, if you have a broken arm that needs fixing, if you need a knee replacement, like this is the place to go. We are the best at doing that. But we're probably we're the worst in developed countries at being able to prevent chronic disease. And as a surgeon, you just don't play much part in that. And I wanted to be on the forefront of progress instead of continuing what we're already great at.
Yeah. Good intro to a term I heard you say before, functional medicine. I know that you're getting your fellowship in functional medicine, right?
Right.
I think I know what that is. Sometimes I get confused, but can you explain what that is? Because to me, functional medicine, it feels preventative. Is it not?
I think preventative medicine was the less sexy term that was coined years ago that people just didn't catch on to.
So they switched to the functional.
For sure.
Someone switched it.
Someone switched it. And now I think that it's actually, been a little bit tainted as well. And so, initially I was fully in saying I want to be a functional medicine physician. And that's still the case in terms of what that means. But I think a lot of people have grappled onto that. You go on Instagram and you start scrolling and you're going to see a lot of people calling them a functional medicine doctor that haven't been to medical school.
Good old social media.
Right. And I'm not saying that to downplay the impact that others can have, like chiropractors or naturopaths. I mean, these people have an insane amount of knowledge that we do not learn in medical school, and there's absolutely a place for that. But I do think it can be misleading, especially when you use functional medicine as a term that crosses so many different specialties, right? Whether you're actually gone through medical training or naturopathic training or chiropractic or whatever it may be. So it's tricky because you need to have full transparency on who you're actually seeing, just so that you are fully informed of what kind of treatment. Because I think you can get unbelievable treatment in any of those options, but if it's something that needs medication management, which I still believe in, we have medications for a reason. We're overusing them for the vast majority of things, and we're using them to cover up symptoms. But you can use certain medications also to target the problem in a way. And so if you're going to somebody who doesn't even have the ability to prescribe medications, then you're kind of missing out on that whole treatment plan. So now, I still say that I'm interested in functional medicine, and that's absolutely right. But I think it's a culmination of all these things. You take functional medicine as kind of the umbrella term of asking why instead of asking what. So we used to just prescribe a treatment for a symptom, and functional medicine is, okay, no, if the roof's leaking, we're not going to patch it. We're not going to patch up the ceiling. We're going to go upstairs and figure out what's going on. And so, that's still in place for me. But also, I like to say that I'm also very interested in regenerative medicine, which is kind of this new front of stem cells, exosomes, PRP, very interesting stuff that I think we need to be paying more attention to. Longevity medicine, which is kind of a subset that is Peter Attia has kind of really pushed. and is really exciting and is basically focused on, let's not only help you live longer, but also help you live better. Nobody wants to live to 100 when they really stop living at 70, right?
Is that the difference between lifespan and health span?
For sure.
I've heard those two terms. Is
Yeah.
that kind of how it
That is
breaks
the
down? You
difference.
just want to live until 80, or do you want to live 80 and be happy?
Yeah, I think we all get into this trap of really chasing a retirement without actually preparing for it physically and mentally. We're just preparing for it financially in our heads. And so a lot of people get to that 65, and I see it every day, especially in the hospital when people get sick and they realize like, oh, I can't go back and change all the things that I should have been doing the last 25 years. We don't realize that when you turn 65 or 70, life isn't just going to be hunky-dory and you're going to be able to get on the ground and play with your grandkids and go travel and lift your luggage over your head. Like that's an algorithm that decreases over time if you don't put in work. And so I think it's really important for people to understand, like, if you want to be 80 years old and you want to go and do the things that you want to do, if you want to live on the third floor of your house and stay in that house, if you want to go and travel and be able to walk 2 miles,
or not have to sell your lifelong house because you can no longer navigate it, right?
Exactly.
Yeah.
Or play with your grandkids or have sex. Like there's so many different things that people just expect that they're going to be able to do. And the physiology just doesn't match up whenever you're looking at somebody that has a typical American lifestyle for that whole period 70 years before.
And if people get educated around this, fundamentally like, hey, I should be thinking about where I'm getting my guidance, right? You just threw out so many terms. You even said subset. If I'm sitting here listening myself, it's like, okay, I need to go see a regenerative medicine specialist. No, it's a longevity one. No, it's a functional medicine one.
Yeah.
No, it's a PM&R. It's kind of like,
Yeah.
So if you have this person who's just like, well, I just go to my primary care doctor once a year.
Right.
They say I'm fine. And if I'm not, they give me some meds. How do you kind of get the best of all the worlds to make sure that somebody is guiding you towards that ideal health span?
That's a question that unfortunately I can't answer very well because we've done a really bad job of building that up from the ground up. We learn almost nothing about nutrition and lifestyle and exercise in medical school. And you hear people like Peter Attia talking about that, and they went to med school 25 years ago, but that's still the same today. I mean, I went to medical school and maybe had one course briefly on nutrition, and then we spent 75% of that other time talking about really in-depth cancer medications that 99% of us will actually never see in practice.
One course in 4 years medical school, right?
Maybe one class
On nutrition.
Yeah, and zero on exercise. It's not like you're in med school and nobody's ever teaching you to teach your patients on how to find a personal trainer, how to prescribe an exercise program, what exercises to be doing for overall function. Like, there's so many things that are by far the most impactful on preventing chronic disease that we don't do. We only focus on treating it once it's already gotten bad.
That's when I've heard you say this, but we put Band-Aids on symptoms instead of addressing the root cause.
For sure.
Right. That's a good way to, if it sticks with somebody, to think about that. So when you round out all of your training, where will like Dr. Clay Moss be in 5 years where like you'll be making a difference with patients? Like, how does someone sit across from you and get you, like, guide me through?
Yeah.
Until I'm
that's a great question.
years old.
Yeah. I mean, that's a conversation between my wife and I think, on where we want to, end up and carry on with the rest of our lives and settle down and have kids. I'll tell you the topics that go on in that conversation are, where am I going to be where I can have the most amount of impact on the most amount of people? The beauty of social media, there's so many things wrong with social media, right? But the beauty of it is that you can actually reach so many people in a short amount of time. And so that's opened my mind to the possibilities that are out there. And so of course I still want to have an impactful clinical practice that I go to on a daily basis. But my mindset has changed on, where can that be, whether it's in a big city or back home in somewhere like Pensacola, or where, and also where is the need the most? And then also, how do I basically do a practice where I'm having more of an impact, but also spending more time with patients? Because the whole thing is about not having 10-minute, say hi, prescribe a drug, and then leave conversations. So we've been talking a lot on how we can develop a really great practice where I can spend a lot of time with patients, but I also have so many other specialties with me that it's a full holistic approach where, sure, you come see me and we do a full metabolic lab panel and we get what your baseline is. And then you go see a strength and conditioning coach that tests out how strong you are and how strong you need to be in 20 years.
That you vetted to make sure that their principles are science-based.
Exactly.
Yeah.
And then going and seeing an exercise physiologist and a physical therapist if you need something, or a chiropractor. I mean, there's so many specialties that know so much in different areas that it would be stupid for me to just be the one-man show and pretend like I know everything, because that's just not true.
Yeah. I may be asking you to get out over your skis with this next question, but when I hear all of that, what it sounds like to me is kind of like the future of medicine, obviously, because we're not there. But do you think that, and this is you just to preface for you,
okay,
this is going to be a guess on your part.
Yeah.
But do you think that our actual healthcare system will get around to being able to support people if that's the future of medicine? Meaning like financially, health insurance can back people that are into like preventative medicine so that they don't get sick, which downstream taxes our healthcare system anyway. You see what I'm trying to ask? Like,
yes, you can get into a long, deep rabbit hole on where.
Let's
Yeah,
what do you?
For sure. But just to say that you can go down some roads on trying to figure out where the incentives lie in the healthcare industry. You can go down a dark road, right? And I don't think that there's any overarching Oz behind the curtain that's just evil and trying to put incentives in different places. But I do think money is a huge incentive. And when you have all of these massive corporations in different areas like pharmaceuticals, like health insurance, it's going to change the landscape in a way that's not the most beneficial for patients or doctors. And I think doctors are kind of the person that's standing right up front that everybody can point a finger at.
Yeah.
And people don't realize that doctors are probably, for the work that they do and the amount of effort that it takes to get there, some of the most underpaid people, overworked, and for a lot of cases very miserable, because they have this dream of getting to a place where they can help patients, and along the way they've just been beaten down and go into a practice where they're just constantly overworked and don't even have time to think about what they could be doing. So to answer your question in a roundabout way, I think the only way for it to get there is if we overwhelmingly force it to, in a way. Because I think if more people start to take their health into their own hands, and that's where the incentive starts to lie, then that's where everything's going to start to go. If more people want to get preventative care, then that will follow suit.
Yeah. I shared this with you, but I work with doctors
right.
in my other head job.
Right.
And I've heard you in other interviews in my prep work for this, I've heard you say something similar. You say, and I really respect it, because you say, don't point the fingers at the doctors. They're working within the system that they're given, but they're good people, and they see it. They see the problem. And I personally, the family medicine docs that I work with, I see them caring so deeply about their patients. And, as an administrator, they'll come to me and say, I need more time with these people. Right. And I see them charting at night. I can literally see, and they're in our systems, like they're spending extra time with the patients and then catching up with admin work at night, just trying to do the right thing for their patients. So, the doctors are not the bad guys. I think they're just working within like a pretty banged up system, right?
Yeah.
No question there. But I wanted to ask, because anecdotally for me, I know it's kind of like maybe a little polarizing word, but MAHA. Right?
Yeah.
Your kind of gut feeling is MAHA bringing us in the right direction? Is it a good response to a problem, or is it more complicated than that?
Well, I will say yesterday they just changed the food pyramid. Did
you see me draw the pyramid?
No,
I was just going to ask you about that.
Funny.
I wanted to see your response to that.
I think that was an amazing thing.
Amen.
I think MAHA came in with a lot of expectations that we all had that we were really excited for, and some of those expectations have not been met. But at the same time, I think the overall general principle of just trying to decrease chronic disease in this country is something that hasn't been addressed in any other administration, both Republican or Democrat. So it's not a party thing in the past 30 years. I mean, it's something that it has been overarchingly been dismissed. And the fact that we're putting at least a lot of publicity on that, I think, is a positive. I think the food pyramid is a huge win, because everything else follows suit. The fact that grains were at the base of our food pyramid for the last however many years is incredibly detrimental to everyone's health.
Dr. Moss, would you mind kind of like high level giving the change, like just kind of summarizing what changed about it?
Basically, they flipped it upside down, which is wild. But if you look at how our overall health as a country has been going for the last 30 years, flipping it upside down might actually not be a bad idea.
Amen.
We are undernourished with micronutrient deficiencies, protein deficiencies. We're not putting our priorities where they should be. We're eating highly processed foods. We're incentivizing to eat highly processed foods with things like SNAP benefits. That's by far the biggest category that's spent on SNAP. And this is in a population that doesn't have the money or the means to go see a functional medicine cash pay doctor that can sit down and educate them and spend that time with them on, no, that's not what you should be eating. You should be eating high quality protein. And you can go get it in bulk at Costco. And like, if you compare that to buying a bunch of ultra processed foods, like the cost is really not that much different. There's ways to do it. Eating one ingredient foods, vegetables. And we've been putting all of these incentives on drinking our calories with things like Coca-Cola or eating most of our daily sugar allotment in the day on one bag of chips. I mean, there's so many things that are wrong with it. So basically what this food pyramid did is it started prioritizing high quality protein, high quality fiber in things like vegetables, whether it be broccoli, Brussels sprout, whatever it may be, fruit. And when I say fruit, I mean whole fruit. I don't mean fruit juices where you're taking out the fiber that slows down your digestion and just spikes your sugars and makes you hungrier an hour later.
Grape Gatorade.
Exactly. Yeah, or fake fruit, right. Basically. So we're basically putting the emphasis back on real food and not on ultra processed food and not on grains that don't deliver any micronutrients compared to the rest of those foods.
Right. Yeah. And you mentioned, fats too, healthy fats, I think
exactly.
are right there next to proteins. I'm pretty sure. I didn't see it. I'm a visual person.
Yes.
I listened to it this morning, but you mentioned SNAP benefits. I'm pretty sure legislation was just passed to actually remove some of those unhealthy foods from SNAP beneficiaries. Isn't that right?
Right.
I'm pretty sure.
Yeah. And I think that's great. I mean, I haven't gone into the weeds of it, so I need to take a look at what they actually did. But in theory, I'm sure the counter argument to that is like, oh, you're just starving people out by not giving them access to more food. And that's just not true. You're keeping access to real food, and you're quote unquote starving people out from what is not food. Like this, if your grandmother didn't eat it 70 years ago or even know what the ingredients are on the back of the bag, then we should not be eating that.
Yeah, I mean, I'm just picturing it. They go up to the register and they, 1 week they can buy Coca-Cola with it, and then they're just told, no, you can't. And then they have to just go back in, and you're just directing them to something that is going to be healthier for them long term.
And these ultra processed food companies are incentivized to, I don't think they have malintent in any form, but if you are a huge company that's reliant on your stocks for your investors and your board, people are breathing down your neck. And if you have the opportunity to work with some scientists on developing something to put in the bag of food that makes it more addictive, then you're going to do it. And that's what everyone has done.
I don't think that is malintent.
Right,
you're
in
less
a way,
cynical
but
than
I don't
me.
think that they're, evil people.
Yeah.
They're just trying to take care of themselves and their company. And like, that's just kind of the way that it goes, which is fine. But when you mix that with the government also encouraging that, then that's where you start to get into rough water. People blame it on capitalism, but it's also kind of a government problem as well.
Yeah. We'll see. I'm gonna make an attempt here. We'll see if this makes the show. But what hasn't made sense to me ever, when I'm kind of like forced to think about SNAP benefits lately, is you have these people who are struggling, they're below the poverty level, and taxpayers are subsidizing these benefits. And because of a lack of education around healthy foods, that those subsidies are going to these people to then buy these foods that, if consumed chronically over time, are going to put them back into the health system. And then they're still struggling financially. And then the healthcare is subsidized for those same people. And
the taxes are raised, and it's a continuous loop of raising taxes in order to basically diverge a population, separate a population, and keep money flowing through the system.
Exactly.
Yeah.
And to me, like when I first learned, like, oh, we're going to take a look at these SNAP benefits. First off, I didn't even think about that. But then when I do, I'm like, it makes sense, because it's not their fault if they don't understand health.
Right.
So to just kind of like limit it up front so that downstream, they're not A, sick, and that's for them, but then B, they're not taxing our overall system on the back end of it. It just makes sense to me. That's my only comment.
The amount of times that I have sat down with patients, especially in my younger years of training where I was going through like family medicine or internal medicine, and a patient says that they've cut out eggs because a doctor told them that their cholesterol was high, and then I ask them what they eat on a daily basis, and they wake up and they drink orange juice and they have biscuits and gravy, and then they have pancakes with syrup, and then for lunch they have, or for a snack, they'll have a bag of Doritos and some chips or some, a brownie. And then you realize, like, what are we doing? Like, those are so much.
Day after day.
Yes.
All right, let's be honest. You're probably not a professional athlete with a personal chef and unlimited recovery time. If you're like me,
You're hitting the gym at 5 a.m. before work or squeezing in training between meetings, just trying to stay consistent while life keeps throwing you curveballs. That's exactly who Purist Nutrition was made for. Purist keeps it simple. NSF certified supplements with minimal, clean ingredients that actually taste good. No artificial ingredients and no proprietary blends where you're guessing what you're taking. Just premium actives like CreaPure, the purest creatine on the planet, whey isolate protein that is US sourced and easy on the stomach, and hydration that keeps you going without all the extra sugar or sodium. Whether you're a parent juggling kids and training, or just someone who refuses to compromise on quality, Purist Nutrition fits your routine. Built for tomorrow, science-backed, tested and trusted by athletes, and most importantly, effective. Visit puristnutrition.com to see the full lineup of quality supplements. That's puristnutrition.com, because your nutrition should work as hard as you do.
All right, Dr. Moss, let's get into, on the back half of this discussion, let's get into you making recommendations for folks through the lens of Healthspan, maybe wanting to be fit and feel great now,
Right.
but building so that they can feel that way their whole life, right? That's the best way I can put it, right? So let's start with nutrition, because we're kind of already talking about it. And I know it's really hard for you to have like a one-size-fits-all recommendation around nutrition. And I know there's so many different like buzzwords and ways that people eat daily, right? We know what they are. But if you had to, if I forced you in a corner and said, okay, this is how you eat to be healthy now and healthy later, what are we talking about?
For the general person, if it's just, let's try to just start a general nutrition program that has the most amount of evidence behind it, that we can begin, and then if we need to adjust anything as we go, then we can. I would probably recommend something along the lines of the Mediterranean diet, just because there's so much data around it on anything from lowering inflammation to heart health to body composition. Now, I will put one caveat to that, is I would recommend a little bit higher of a protein intake than the traditional Mediterranean diet tends to push. But I think the Mediterranean diet is amazing in the fact that it's very well balanced, because you're getting a certain amount of protein, you're getting your fiber with vegetables, you're getting some fruit in there, you're having a little bit of grain, so it's not being overly restrictive. I think the biggest thing for people is not restricting them right off the bat so much to where it's just not sustainable. The best possible prescription that you could give somebody from a nutrition standpoint is sustainability. So if they can learn how to cook their own food, that's rule number one, is learn how to cook your own food. Because I didn't. When I got out of college, I didn't know how to cook my own food.
Don't.
Still barely know how to cook my own food. But at least I know how to grill a steak, make some eggs, put some Brussels sprouts in the oven. Like
I can do that.
Exactly. I know how to pick up fruit at the grocery store.
Scrambled eggs.
Yeah, I know how to scoop blueberries onto a plate.
Right.
You know, so I mean, it doesn't have to be hard. And I think the simpler, the better. The more one ingredient foods that you put on your plate, the better. And the more colorful your plate is, probably the better too. I think protein is probably the biggest one that people lack on, though, is that they're over consuming carbohydrates and they're under consuming protein.
Which is the food pyramid before it got reversed.
Exactly.
Right?
And I think that's a good place to start. Like, actually, if you want a good place to start, I think the new food pyramid is an amazing resource. And it touches on the new protein recommendations. It used to, the RDA for protein used to be 0.8 grams per kilogram of body weight, which is dramatically low for everyone. And so now I think they put 1.2 to 1.6 grams per kilogram at least of protein for your body weight. It's actually for your ideal body weight. So if you're 250 pounds, you want to get to 220, you should probably go off that value. And that's actually pretty hard to do. You can go higher than that. If you have performance standards that you want to meet, or you just want to maximize muscle mass, which I think is an amazing goal to have, especially for an aging population, getting closer to that 1 gram per pound of body weight.
Thanks for getting rid of the kilograms, because I'm not as smart as you.
It's, yeah, everybody's got to bring out their phone, and that's just one more step.
Yeah.
So I think 0.6 grams per pound to 1 gram per pound of body weight is great for most people, and I would aim for the higher.
Okay. And is that, you're saying that now the new recommendations from the government and the food pyramid actually gets into the specificity of the grams per, wow.
Yeah. And it doesn't go that high. And I wish they did make a caveat to say, you know, higher actually is good too. But they do recommend significantly higher than what the RDA was previously, which I think is a huge win.
Okay. And I'll just, I guess, drill down a little bit deeper. One more, I don't know if I'll call it advanced thing around nutrition, but so Mediterranean, gotcha. Fasting. What's your thoughts?
Fasting has been used for thousands of years. I mean, it goes back to biblical times, right? I mean, there's a reason why people fasted, and there still is a reason. There's a medicinal reason why to fast. It starves unhealthy cells, and it forces your body to basically kill cells that don't need to be there anymore. Your body goes into this starvation state where it's like, let's get rid of everything we don't need, and it's going to target the cells that don't need to be there first. You can go down the route of, fasting for things like cancer or disease prevention or metabolic disease or insulin resistance. I personally do an extended fast, 3 to 4 days once a year for those benefits. But for the general population, we hear a lot about intermittent fasting and all the benefits from that. I think by far the benefits are from calorie restriction. And you can get calorie restriction from a couple of different ways. You can do time restricted eating like intermittent fasting. You can do calorie restricted eating, which is basically where you are counting calories and purposefully taking things out of your diet to do that. Or you can do basically food restricted eating, where you're taking an entire food group like carbohydrates or sugars or whatever out of your diet.
I hadn't heard of that.
And I think the easiest way to probably do this is the intermittent fasting schedule. It depends on the person, because if you're somebody that really needs that protein requirement, it's harder to get that protein in when you're in a restricted zone. So I personally don't intermittent fast. I have in the past, felt great, but I personally like starting my day off with a high protein, either shake or breakfast with a little bit of fat, so that my brain is wired well. If I eat carbohydrates in the morning, personally, like I have this spike and then I am done by noon and I can't think straight anymore.
Yeah. Difference again between intermittent fasting and time restricted eating?
So they're the same. It just depends, but they're interchangeable for the most part.
Got it. And what would be, just I guess maybe a little bit deeper for you, recommended approachable protocol time-wise if you're going to go the time restricted eating, assuming people have like a normal circadian rhythm, normal schedule? What would you say, like eat at this time and stop eating at this time?
Yeah, I mean, I would probably stop eating before 8 p.m. and not eat your next meal until 12 noon. 12. So basically you can eat from noon to 8 p.m.
Okay.
Yeah.
Okay, got it.
Yeah, and I think that's a pretty standard way to do it.
Okay. And good segue here. You mentioned sometimes it's hard to get enough protein. And if you're only eating based on that recommendation for 8 hours, and you also have a calorie goal, sometimes it's hard. You're a busy guy. I'm a busy guy, right?
Right.
What are your thoughts on supplements?
I think getting a high quality protein powder that agrees with you. Some people, their stomachs don't agree with certain different protein powders. I think getting a high quality, preferably animal-based, like a whey protein, grass-fed, grass-finished protein powder that's sourced correctly is great. I don't think that you should solely rely on that as a meal replacement in order to like lose weight or whatever. But I think in order to hit those protein goals, it's an amazing thing in order to just kind of supplement here and there. I personally take a 50-gram protein shake every single morning because it's hard for me to get my protein goals.
And is your goal like around 200 grams a day?
I try to aim for 180. I'm so 180
that's
pounds right now.
A quarter of your protein right there in the first.
Very hard to do still, even with that. And sometimes I'll even do another one later in the day. I try not to. I try to get it mostly in food, but I have no problem doing another one later in the day if I know for a fact, like I just didn't get there today.
Yeah. I was on the road yesterday. I had 6 hours of driving yesterday. I don't know how I would have gotten hit my nutritional goals if I didn't have supplements. It's like impossible some days, What are some other supplements, if you had to pick maybe like 2, 3, 4, whatever more that you would suggest people look into?
First of all, I would always go and get comprehensive labs done. I have to say that because I think it's important to supplement for deficiency instead of supplementing just as a shotgun approach to see how you feel or whatever some influencer tells you. So I will say that. I think if you took the vast majority of the population though, and what would be beneficial, most of the population is deficient or insufficient in vitamin D, in magnesium, and in omega-3s. And I'll add one more to that, which is creatine monohydrate, which is like one of the more exciting ones that we've been getting more and more info about. And it's probably the most studied supplement in history, especially performance supplement. It is the most studied. It has more studies on it than any other performance supplement. And I'll tell you why. So vitamin D is just involved in literally thousands of processes in the body. It acts as a hormone. It dramatically basically influences your entire hormone cascade all the way down to testosterone, estrogen, stress hormone, cortisol. We're not out in the sun as much as we used to be. We're clothed now mainly when we go out in the sun. I mean, you cannot, it's very, very hard, even in the summer months, to get enough vitamin D in. And I think people are living at a deficiency, and it's not one of those things that there's overt signs. Like a vitamin C deficiency, you know, your gums start to bleed, they start to shed. A vitamin D deficiency, you don't really have those overt signs. So no doctor's going to walk in, and as soon as you walk in, they're going to be like, you're vitamin D deficient, right? So a lot of people miss that, and it impacts so many different things. I mean, I think it's involved in encoding like 9% of the entire human genome. If you just think about it that way, it has a huge role in everything that goes on in your body. So vitamin D is great. I think for the vast majority of people, 4,000 units of vitamin D a day is a pretty safe bet. Some people need more. I think pairing that with K2 is great, because the theory there is sometimes if you overload on vitamin D, you can encourage calcium to build up in arteries, whereas K2 kind of shifts that influence more into the bone, which is where calcium needs to be. And vitamin D, K2 supplements are very common. Magnesium is another one. It's involved in over 300 processes in the body. It's used as a cofactor for a lot of different things that happen. And it's involved in stress management. It also has an impact on the hormone cascade. But the main one that we see is by far stress and sleep and being able to calm your mind and all of these different things. And so to get a red blood cell magnesium in your labs is very important, because you can kind of see where you're at. Most people, I think 200 to 400 milligrams of a high quality magnesium at night is beneficial to their sleep and just their overall well-being. There's different forms of magnesium.
I was just going to ask, it overwhelms me. The threonate, glycinator, I'm just going to look up some words, but what are the differences?
Exactly. And even in the hospital, we give patients magnesium for supplementation, and it's magnesium oxide, which is like 2% bioavailable. So they're really not getting anything. It's just the hospital trying to save some money. And if you go to a CVS or a Publix or one of those stores and you just see a bottle that says magnesium in big letters, I would bet you all my money that it's probably mag oxide, because those stores are just trying to make as much profit as possible, just like any business. And so you really have to go and find really high quality brands. But I would look for magnesium glycinate is kind of the gold standard, because it influences being able to calm down your mind and influence sleep. And it's not super expensive. So that's the one that I personally take. Magnesium threonate's interesting because it's the only one that can actually cross the blood-brain barrier.
What does that mean?
So that means that basically when it's circulating in your blood, the brain has a really intricate layer, a shield defense of trying to keep a lot of other pathogens that might be circulating in the body from getting into the brain.
Sounds like a good thing.
It's a good thing. It's very fragile, but at the same time, it's really hard to influence the brain with certain supplements or medications because they don't cross that barrier. And it's something about the threonate that's paired to the magnesium itself that allows it to cross that blood-brain barrier. And so a lot of people see this more profound impact on sleep and mood regulation with that. I would say if you're taking glycinate and it's not working at night, maybe switch to a threonate. It's a little bit more expensive, so it's not my first line. And it actually doesn't raise your blood levels of magnesium that well. So even when people are taking magnesium threonate, I recommend they also take another form maybe in the morning. Magnesium malate's great too. It's actually really good for muscle recovery, like especially after workouts and things like that. So that's typically what that's used for. So if people don't like glycinate, I switch them to threonate. Omega-3s are amazing too, and primarily involved in brain health. The lab to look for in that is actually called an omega-3 index, and we like to aim for around 8. There's some really interesting studies looking at the risk of having low omega-3s. Japan actually has insanely high omega-3s in their general population. So if you look at the average Japanese person compared to the average American's omega-3 index is sitting at about 4%. The average Japanese person is sitting at about maybe around 8%, I believe, and their life expectancy is 5 years higher. Now that might be because of other reasons, but I do believe that that is part of it. And then there's some studies showing that if you have an omega-3 index less than, I can't remember if it was 2 or 4, but at least on the very low end, which a lot of Americans are walking around with, it actually increases your risk of all-cause mortality more than if you were a smoker.
Really?
Yeah.
Wow.
So it has a very profound impact, and that's one that I always like to test with people, because it's one of those like vitamin D, you don't really know if you're walking around at a deficiency. We're not eating a bunch of fish, or at least most people aren't.
Right. But your Mediterranean recommendation would have people eating more fish if they follow it to a T, right?
It would. But omega-3s are one of the only supplements that I actually think might even be a cleaner source of omega-3s than the fish themselves nowadays, just because of how we source our fish. Unfortunately, I think we've gotten to that point. And a lot of other experts that I really trust, like Rhonda Patrick, seem to agree with that too. And then creatine, I do want to touch on creatine real quick.
Yeah, I was going to ask you to drill down a little bit more on creatine.
So creatine is amazing, and it used to be the bodybuilder supplement, right? Like my parents told me when I was in high school, like they caught me taking creatine, and I think I was probably grounded for it.
Someone threw me a tub as like a junior in high school.
Exactly.
Here, kid.
Yeah, exactly. Like they're dealing, TRT in the back alley gym.
Right.
Yeah, and my parents got pissed at me for taking creatine because they thought I was going to wreck my kidneys or something like that.
I remember those days.
Exactly. And what we've come to realize is how wrong we've been the entire time, or at least that side has been the entire time. And creatine is amazing for not only muscle health, muscle recovery, muscle protein synthesis, ATP regulation, but also for the cognitive impacts that we actually didn't know about 5-10 years ago, and are starting to come out when you take creatine, maybe at a little bit higher dose than that typical 5 grams that's been recommended. The theory there is that around 5 grams tend to be taken up by the muscles pretty quickly on a daily basis. And then whatever that spillover is kind of gets towards the brain, crosses the blood-brain barrier like we mentioned earlier, and is able to make the recycling of ATP, which is our body's, that's basically our fuel source, our monetization of energy. It makes that process more efficient to recycle ATP. So if you think about things like sleep deprivation or brain fog, I think creatine plays an important role in that. And a lot of people say that if they take 10-15 grams of creatine, they start to notice that even if they had a bad night's sleep, they're a little bit more cognitively sharp.
Would your recommendation on dosage for creatine be based on the size or the activity levels of the person, or is there like a one size fits all that you think?
I think for most people, 5 grams of creatine is an amazing place to start. The previous notion that creatine causes kidney issues has been completely debunked by numerous studies now. So I'm not concerned about that. Now, if you have pre-existing kidney issues, I would always have that conversation with your doctor, even though I still think it's a conversation that's worth having. 5 grams is great, and it will take care of increasing or at least maintaining lean muscle mass. Going into the 10 grams, 15 grams range, we haven't really seen any risks in that either. And I think there are a lot of benefits on the cognitive side. So I would recommend starting with 5. Some people have GI irritation, like gut irritation with it. So start with that. Make sure you're not having any like upset stomach or anything. And then if you want to, like start dipping into the 10, 15 gram range.
Start with 5.
Start with 5.
Thoughts on 3 habit kind of nutrition things? Alcohol, nicotine, caffeine.
Okay.
Maybe a couple sentences on each. Just your thoughts on those things that you can consume.
So there's no healthy limit. There's no healthy amount of alcohol. A lot of people love that red wine has resveratrol in it, and that was that thing that came out a while back that everybody started to say, okay, now I can drink and it'll be healthy for me. The amount of resveratrol in red wine is so minimal that you would have to literally drink like a truckload of red wine to get any resveratrol benefit, and you're consuming enough alcohol to probably kill you at that point. So I don't think there's any healthy limit of alcohol. Now, I personally drink socially every now and then. I've dramatically cut down my intake of drinking just after realizing how terrible it is for me. I would tell people to be very cognizant of that. And if you wear something like a Whoop strap, I don't know if you've noticed, but if I have 1 glass of red wine or 1 beer or whatever, I can sleep 9 hours and I will still be in the red, 20% or less recovered. 100%. Yeah, it knows. And it's pretty crazy to actually see that. Because even though you might not feel hungover, your body's telling you that you are hungover.
I've been so open with like the season that I struggled with alcohol. And the thing that made me make a change was seeing the objective impact on my recovery. There's one thing to say, I just don't feel good today. I'm hungover, anxiety, whatever. But to wake up and see the impact on my heart, I was just like, well, got to make a change.
Exactly.
100%. Yeah.
What was the second one?
Let's go with nicotine.
So nicotine is an interesting one. I think a lot of it depends on the route of consumption. You look at things like, obviously, smoking cigarettes. We used to think that was healthy for us, right? Then we realized how wrong we were. Vaping is the new, I guess not new, but in the last 10 years, especially since I started college, has blown up, especially in really young people, high schoolers, sometimes middle schoolers. And I think that's really concerning. And people just love to say like, oh no, it's just nicotine, there's no tobacco. But you don't realize that, tobacco really wasn't the entire problem with cigarettes. It was a lot of the chemicals that you put in cigarettes that was causing the inflammation and really pushing that threshold towards a cancer type physiology. And we don't know what's in these vapes for the most part. I mean, if you go to a store now, if you go to a gas station, all these things have like video games on them now. Like they're designed to hook people that are young. And there's nothing naturally in the world that tastes like white gummy bear.
Right.
So you don't know what's in it. And there's hundreds of these chemicals that are in these vapes. And so I think we're going to realize that a lot of what's happening in the health of the youth might be attributable to that. Now you get into nicotine by pouch, like Zens or any of these other ones that people are taking. These are blowing up. And I think that there is a positive and a negative, right? Nicotine can raise blood pressure. And so if you're somebody who's not generally healthy and you're constantly raising your blood pressure, you increase the risk of so many different things like heart disease, like stroke, all of these different things. So I think that's a negative. You're also becoming addicted to something, which is also a negative. It's not good to be dependent on anything, I don't think. And especially the higher and higher dose you get, the more and more it's going to raise your blood pressure, the more and more you get addictive, the harder it is to get off of it. And it's just saving yourself the misery. I do think it's a much better alternative than vaping. And so if people are vaping, I would actually urge them to maybe switch to a pouch or something like that, or a patch in order to get off of the vape. So I think that's a great step down. Nicotine is a neuroenhancer, and it can actually help with things like brain fog. And I know a lot of people include it on their protocols with people that do have long-term brain fog. I've personally tried it. I've actually seen a little bit of benefit. Now, I do think if I take nicotine in a patch or a very low dose, like I don't do anything above like 2 milligrams of nicotine in a pouch, and I rarely ever do it, like not even once a week. But if I do it past like 2 or 3 p.m., it's kind of the caffeine effect for me where I'm not sleeping well at night.
Really? Nicotine does that too?
Nicotine does have that effect, and it lasts for a few hours afterwards. So you can definitely see some sleep impacts from nicotine later in the day.
Yeah.
So I would go as far as that to say that. I think there's a lot of hype around nicotine, and I think it is a slippery slope, but there are some cognitive benefits there that I will give it credit for.
Yeah. It's another one of those things, if you just kind of observe culture from afar, it's like nicotine came in hot. And like, nicotine. And then you almost have to like sit back and wait, because now even like Dr. Rhonda Patrick was just talking about it. Well, here's like the downside of it. I even think of random stuff like cold plunges. Comes in hot. Right. Everyone's like, go. And then all of a sudden, cardiovascular issues, right? So it's another one where you have to kind of tread lightly is kind of my view on it. The last one's caffeine.
Caffeine's also a neuroenhancer. Like 99% of us have taken caffeine. We love waking up in the morning and getting our coffee. Now, coffee has amazing benefits in itself, just with the polyphenols and everything that's actually in coffee can significantly, I'll say that, reduce things like cardiovascular disease and dementia later in life. And that's even shown with decaf coffee. So it's not necessarily the caffeine that's bringing those benefits, it's the things that are in coffee. I think where people get into a trap is they are drinking things like Celsius or like all these energy drinks that have so many other compounds that your body has to process in them. And that's where it starts to get, it's an unnatural source. Coffee is coming from the ground. I actually trust that a little bit more, and call me a hippie, but I do. I don't trust things like energy drinks for the most part. Now, if it's a naturally sourced caffeine and you're thinking about things like exercise performance, I think that it is a powerful tool that can be used if it's used correctly. If you have, like, let's say a pre-workout that has clean ingredients and you're seeing everything that's in it, it's not like a proprietary blend or something like that where you don't know exactly what's in there, and it's third-party tested, certified, like NSF preferably, and it has caffeine in it, and it's maybe in between like that 80 to 200 milligram range, not like 300, 350, then I think that could be used, especially if it's used earlier in the day. Where I see people going wrong is that they're taking pre-workout after they get off work and they're going to work out at 6 p.m. and they wonder why they're not sleeping at night, and then they don't sleep at night for so many days and they start getting depression symptoms. This is where the traditional health system starts to fail. And I noticed this even in my colleagues in medical school, is that everybody started out super caffeine addicted, and then they were super tired early in the day, and then they needed things like Adderall to kind of get them through the day. And then their sleep was impacted by both the nicotine and the caffeine and the Adderall. And then they get on antidepressants because they're not sleeping and it's impacting their mood. And so by the end of my medical school, you know, people love to compare and contrast the medications that they were on in order to just get through daily life. If somebody just addressed that root cause in the beginning, I think a lot of it could have been avoided.
Yeah. Well said. Well said.
Let's be honest, most of us don't have a private gym, a full-time trainer, or hours every day to lift. If you're like me, you don't even have time to commute to a local gym. You're training early in the morning or carving out 40 minutes between work, kids, and everything else competing for your time. And when fitness matters that much to your well-being and your health, you've got to have home fitness equipment that's as strong and reliable as you are. That is exactly why I use Rep Fitness. Rep is built for people who train with purpose, people who need high-quality, reliable equipment engineered for real strength. Designed right here in Colorado, USA, Rep Fitness provides racks, benches, bars, and plates that offer commercial-grade durability without commercial gym prices. Premium materials, smart engineering, and fair pricing. Whether you're outfitting your very first garage gym or upgrading your current setup to match where you want to go with your training, Rep makes gear that keeps up with your life and your goals. Visit repfitness.com to see their full lineup. Racks, benches, bars, plates, conditioning tools, and everything you need to build a home gym that works as hard as you do. That's repfitness.com. It's finally time to pursue your strength.
Well, alcohol, nicotine, caffeine.
Yep.
Tread lightly.
Yep.
I feel as though all three.
In
benefits.
moderation.
Yeah, in moderation.
Yeah.
Okay. I'm going to ask you a similar question. We'll transition to strength training. I've heard you say, I believe, strength is medicine.
It is.
Have you said that?
Yes.
Thought so.
Muscle is medicine.
Yeah. What did you mean by that? And I'm going to ask you a similar kind of question around like if you had to, or if I forced you to do like kind of a one size fits all, here's how to approach strength training as medicine and Healthspan and all that, what would that look like? But what do you mean by strength is medicine? Let's start with that.
Yeah, so I mean, I think if you look at some of the data of comparing what is going to decrease your all-cause mortality, you look at like the hazard risk, right, of things like smoking and diabetes, I think is around the 50 to 70% mark of if you're a smoker or you have diabetes, you are 50 or 70% more likely to die sooner than somebody who is not. Now, you look at something like strength. If you are somebody who is strong, let's say in the top 25%, versus somebody who is weak, let's say in the bottom 25%, the hazard ratio there is something around you are 250% less likely to die before somebody who is less. And then if you look at VO2 max, which is kind of a cardiovascular marker, it's up to 400%.
Wow.
So you could make that argument that the impact of strength training and of cardio fitness is more impactful than trying to focus solely on preventing things like diabetes or even smoking. Now, I think smoking is the lowest hanging fruit. Nobody should smoke.
Yeah.
But it is that impactful. And so I think we've been dismissing that for a long time. You know, I talk to my parents or anybody in my parents' or grandparents' generation, and you ask them, oh, you want to lose 20 pounds this year? How are you going to do it? Oh, I'm going to hit the treadmill, right?
Right.
And I think people have really overlooked the impact of strength training on metabolic health. And we're so focused on a scale that we're missing the body composition part of it.
And the strength training, what do you think it is about being strong? Is it the bone density? Is it like, why does it even matter? I don't understand.
So many things. So you can get down deep into the biochemistry and the physiology of what muscles will actually release while you do strength training that actually has a huge serotonin and dopamine effect, right? Like a drug.
Uh-huh.
So there's that aspect of it, which is great for your overall mood, your motivation, everything else. There's also hormonal aspect. We know that people can significantly improve things like their testosterone levels by lifting heavy things. And that is unbelievable for just vitality in general. You also get down into, it is great for bone health. When you load your body with weight, it's unbelievable for bone health. And one of the biggest things as you age is osteoporosis and the risk of falling and breaking a hip. Like the mortality rate of 5 years out of somebody that breaks a hip when they're 65 is horrendous. And so if you're not only padding your body with excess muscle, you're also teaching your brain, like when you're lifting, you're stimulating your brain on how to balance, how to go through life, how to operate on a day-to-day basis. You're gonna be less likely to fall. You're gonna have a little bit better of a cushion per se from that muscle of breaking a hip, and you're gonna have stronger bones so it won't break in the first place. So that's huge. So I think frailty is probably one of the biggest killers of people that I see in the hospital. Is first of all, I never see somebody come in the hospital that is in great shape and has decent muscle mass. Like, you almost never see that. But when you do, those patients tend to do very well no matter what they're in for.
Yeah.
And that might be anecdotal data just from myself, but I personally believe that just from what I've seen.
Yeah. So if you had to recommend it, I think there's two different ways that you might answer this, whatever feels, I guess, more simple for you and for the listener. But if you had to recommend either a strength training protocol, and that's a split, as they say in the real world, right? Or even just like zero in on the principles that every good strength training protocol should cover.
Right.
What would you recommend someone maybe that's not strength training and they can start, ease their way in?
Yeah, I think if you look at the most functional movements that we do as we age, I mean, you're squatting down, you're picking things up, you're putting them back down, over body strength. Like we talked about earlier, the person who's 75 and wants to lift their carry-on luggage into the airplane, stowage bin above them. You want to lift for function. And a lot of it is lifting for aesthetics, and I think it bleeds into that a little bit. But when you're lifting for function, you're learning how to do things like deadlifting safely. You're learning to do things like squatting safely. You're learning to do things like overhead press, if you have good shoulders, safely. Bench press, like all of your what you call compound movements. So bending over and actually, lifting with your back, hinging at the hips instead of rounding your back. I think one of the most powerful things that people can do is go and get a personal trainer. Now, granted, personal trainers are expensive. I personally don't have a personal trainer. I'd love to. But going and getting a personal trainer 1 or 2 times just to walk you through the gym and make you comfortable of going to the gym, because that's the first barrier. People who haven't been in the gym in 50 years, they think that they're going to walk in and every head's going to turn and they're going to look at them, and that's just not the way it is. But get you comfortable in walking around in the gym setting, getting comfortable in what things to use, whether it be machines or free weights or whatever. And then B, 1 session on just teaching you, how do I do these movements with correct form so that I can increase my strength? And what we used to see is that doctors would recommend that women or osteoporotic men over the age of 65 not do heavy lifting, because we used to think that it actually increased the risk of things like fractures. And there was a really important study recently called the Lift More study, where they took osteoporotic women, some of them had already had fractures, I believe, and put them through a heavy strength training regimen where they were lifting like 5 rep maxes of things like squats, deadlifts, bench press, all of those different things. And they saw not only did it stagnate their bone mineral density from going down, which we thought might have been best case scenario, it increased bone mineral density. So it increased the thickness of their bones at 65 and up years old, which we didn't think was possible.
Yeah, intuitively, I wouldn't think it is. You'd think people are just kind of on this like downward.
100%. You would think it's preventative medicine, not actually building something, but it 100% can actually change in a positive way instead of just keep out the risk.
Wow. So I'm hearing functional movements, things that maybe even like mimic daily life needs. Strength, heavier loads potentially relative to the person.
Safely, with good form.
Good call.
And even if you're looking up videos, but I would suggest finding somebody who knows how to do it and who can look at you, because we don't know what we look like, right, while we're doing something. And I would recommend at least, at the very minimum 2 days, preferably 3 days a week of lifting for 30 minutes to an hour.
When I hear that, I'm thinking full body. Hit your full body in 1 session 3 times a week.
I think that's great. If you're somebody that is young and you want aesthetic goals, then sure, you can work out 4 or 5 days a week. That's fine. And you don't have to do full body every day. You can do push, pull, legs, whatever you want to do. My thing is just getting people in. Yeah. Right? Like, I think the biggest barrier is getting somebody in and staying in. If you start getting really intricate into the weeds with a lot of patients, they lose sight of it. So I think first getting somebody in. Full body is great. Having a simple full body routine where you're just in there for 45 minutes maybe can do wonders for somebody's life.
If I'm listening, I'm thinking, well, that's approachable. It's efficient. I don't have to be in 6, 7, 8 hours a week and things like that.
Right.
How about cardiovascular training? There's if I had to break it down into 2 different camps, there's high intensity stuff, shorter bursts, lots of effort, longer moderation, things like that. Zone 2 is a big buzzword. Maybe it's here to stay. But how would you then also, through the lens of Healthspan, living longer, how would you layer, let's go with the 3 days a week, full body. What would you recommend to layer cardiovascular training over top of that? Yeah,
I would do 3 days a week of cardiovascular training and 3 days a week of lifting. And 3 days a week of cardiovascular training, it can be something like going on a brisk walk through your neighborhood for that zone 2. That's what we talk about, zone 2, which is kind of, zone 2 is amazing if you do like 45-minute, hour-long sessions of zone 2. And an easy way to figure out if you're in zone 2 is basically, if you're huffing a little bit, but you can carry on a conversation, you're probably in zone 2 cardio.
Talk test.
The talk test.
Yeah.
So if you can hold a conversation, but it's a little uncomfortable, that's probably where you are at in zone 2. And that's unbelievable for increasing your VO2 max in a way, but also just enabling your body to use oxygen more efficiently, which is amazing. I mean, you even think of things like heart disease. What causes heart disease? It's a lack of oxygen to the heart. So if your body can use oxygen more efficiently, it helps so many different areas, from heart to brain to muscle, whatever. Now, I think that high intensity cardio is extremely beneficial when it comes to aging.
And hard.
I think if you compare low intensity cardio versus high intensity cardio, you get 4 times the amount of benefits with high intensity in the same amount of time.
Wow.
So now granted, you can't do high intensity cardio for an hour, right? So I think short bursts of high intensity cardio, one of them is called, you'd probably know, the Norwegian 4x4 or something like that, where it's like 4 minutes hard, 4 minutes off.
I've heard Tabata.
So Tabata is a great one too. So all these buzzwords I think are great for people to do. But it also depends on where they're at. We're not going to throw somebody that, has cardiovascular disease and diabetes into a strict high intensity cardio regimen.
Right.
So I would just say get the ball rolling, get moving first, and then work your way into more high intensity cardio.
It's interesting because, we both wear pretty advanced heart rate monitors, and I program habits into this. It's looking at my sleep, it's looking at my exercise, all those things. And it kind of spits out this prediction of how old is my, help me out, cellular age. I don't know what the technical term is. Does that sound right? Like your biological age, whatever. Right. And the one metric, VO2 max, which you said earlier in this interview, when that goes up, that age goes down so fast. And it's amazing to me because I can work so hard on these other habits. I can be in the gym 6 hours a week, whatever it is. But if I focus on the higher intensity training for less time every week, if I can move that needle for VO2 max, that's the thing that seems to make the difference with my health span. Does that ring true for you?
100%. Yeah. I don't know how accurate a lot of these biological age markers are, but I think it's a really important visual of how much you can move the needle with something like that. We talked about, the risk of dying from literally any cause earlier. And if you're somebody in the top 2.5% of VO2 max for your age, and you're compared to somebody in the bottom 25%, you are 400% less likely to die from any cause than that person.
That's wild.
Yeah.
That is wild. It just speaks to the magnitude of that.
And that's something that I've completely ignored in the last 10 years because I was in college. I just wanted to look good at the beach. Basically, I was lifting for aesthetics and I wasn't doing any cardio. And so I'm playing catch up right now. Like my VO2 max is not where I want it to be. I went and got it tested at a legitimate place. Or you can use these. These are pretty accurate as well. But that is something that I'm actively training for right now.
Yeah, metaphor, cheesy maybe, but like you can look at the outside of a car, looks great.
Exactly.
Lift up the hood. What's going on under there? And until you do that, you don't really know.
Yeah, you can look like a Ferrari on the outside, but have a Honda Civic on the inside, which no hate to Honda Civics, great cars.
Longevity.
Right. Right.
Kind of exit question for you before we kind of wrap up with like what's next for Dr. Clay Moss. But we're kind of building the perfect week here. So we talked about daily nutrition. We kind of talked about like a weekly prescription for strength training. But what are some of the other things that people can do day in, day out, or maybe on a weekly basis, particularly to increase their health span, to live longer? It gets overwhelming as a consumer sometimes. You hear all these different mechanisms, infrared and cold plunges and saunas. And you're just like, what do I do? Yeah. What did I miss? And what other recommendations would you give to people?
I think the biohacking world, it looks fun and sexy, but it kind of clouds the big hitters on what make the most impact for little to no money. And so, we can start from waking up in the morning. I think one of the things that's profoundly missed, and people like Andrew Huberman are the biggest voices in this space, is get outside and get morning sunlight. You think from an evolutionary perspective, that's what used to happen every single day. We didn't live in these unnatural environments with LED lights and windows keeping UV lights from coming in, all of these different things. And if you don't get outside and get natural sunlight in your eyes, on your skin, put your feet in the ground. I really believe in grounding. I think there is a profound, maybe even spiritual impact on touching the surface of the earth. And it's an interesting test to do at home. Like, we're not grounded here. We can walk around in our barefoot all day, every day, put shoes on, get in the car, go to work. We don't, some people don't actually ground with the surface of the earth for weeks.
I won't today.
Yeah.
Until you said that.
Exactly.
I'm just thinking about it. I don't plan on it.
And there is rising amounts of evidence on the anti-inflammatory and just kind of overall vitality impact of grounding with the surface of the earth.
Yeah.
Getting out in morning sunlight in the morning spikes your cortisol, and so it brings down that cortisol towards the end of the day and allows you to sleep better at night. What happens is that we wake up with this kind of halfway elevated cortisol level. We don't have that spike, so we just sit there at this kind of borderline level all day, and by the time we're going to sleep, that's when you have that I'm wired but I'm tired,
right?
Feeling where, man, the entire day at work, I could lay my head down and I could go to sleep right here, but as soon as I get back in bed, I can't go to sleep.
Yeah.
That's what that is. So I think getting outside and getting that morning sunlight is huge for that. Getting protein in early in the morning and maybe a healthy amount of fat instead of carbohydrates, I think is something the vast majority of people can do. Don't wake up and eat, grits and hash browns and pancakes and all of these other things. Like, have eggs, ground beef, have a protein shake, have some healthy fats like butter or avocado oil, have an avocado. Like, these are those things that are not only going to help build muscle, right? Hit those protein goals that we talked about, but also support your brain throughout the day. You're not going to have those ebbs and flows of energy throughout the day. You're not going to be consciously counting down the minutes to the next meal,
right?
Which we all get in that trap, right?
What's that fancy word?
Satiation. Yeah. So you're much more satiated on protein and fats than you are on carbs. So I think that's really important. Movement throughout the day. I mean, we sit at desks 9 hours a day, and most people aren't even getting up just to go to the bathroom once a day.
Right.
So like every 15 to 45 minutes, I would just get up and walk around, go on a lap around your place. Even if there's even studies saying the people that are fidgeters burn consistently more calories and have less sugars just by moving. And so there's a dramatic impact on just little movements here and there. So I think just being cognizant of, I have been in my chair for an hour, I have got to get up. Like, this is not bad. This is not good for my health. Obviously, we talked about eating high quality foods. Later in the day, some things that I see that a lot of people miss is bright overhead lights, especially after around like 5 or 6 p.m., can dramatically reduce your melatonin production and that circadian rhythm that we were talking about earlier. So this is kind of that second piece after the morning sunlight. You're trying to bring down that cortisol. There's some studies that Andrew Huberman has pointed out where, just having a bright overhead light for like 15 seconds can completely halt melatonin production, which is an hours long process going into the night. So I think having like that lamp over there, that warm, low level lamp that's a warm color, is great from an evolutionary perspective. Because you think about, if you're a hunter-gatherer back in the day and you're living, let's just say, in a tent or a teepee, your body is telling you to be awake when that sun is up. And then when that sun is at eye level and has that warmer hue like a sunset, your body is starting to tell yourself it's time to start getting ready for bed.
I hadn't thought of that.
Yeah.
Yeah.
I mean, if you simplify this to how it used to be whenever we were cavemen, it all starts to make a lot of sense. And the science backs it up really well.
Except there's no bobcat waking us up in the morning.
Exactly. There's no bobcat. That's a good thing.
On the lights real quick, it's interesting, chaotic daily, a nightly kind of routine for us is we have the 3 little kids, we're doing dinner.
Yeah.
It's chaotic right now for how my kids are. But afterwards, like, all the lights are blasting.
Yeah.
And the funny way I say it to my wife sometimes is like, what are we in Walmart? Like, you have like these bright lights.
Yeah.
So I'm always going around the house and because we have them on dimmers, and I'm just dimming them down.
Yeah.
And I didn't know the science behind that, but maybe there's something that I'm aware of subconsciously that I'm trying to calm myself with lighting.
For sure. And my wife makes fun of me because like I will not allow bright lights in our bedroom. Like, we have like almost red lights in our bedroom to the point where it's like looks borderline kinky. Like, it's like, it's
she's in my head.
Exactly. Yeah, but it's great from like an actual physiologic standpoint. Like, if you have warmer lights that are low level and like low eye level, it's much better for sleep. And you think about even our grandparents' generation, it used to be halogen lights, which were actually much better than the LED lights that we have nowadays, which we've mass produced. Like, if you look at pictures of like LA 50 years ago, it looked warm, right? And you look at an aerial picture now, and it's like harsh and white.
Yeah.
These LED lights have a flicker rate that we can't see, but if you took a slow motion, if you took your camera out and put it on slow-mo, you will see the flickering of the light in there because, and that's what kind of causes that daytime fatigue of sitting in an office all day, is that there's a flickering around that you don't really realize, but your brain will pick up on it.
Could that be making us stressed as well?
100%.
Like that, just subconscious, like what is that?
100%.
Stimuli? Yeah,
it's definitely an annoyance to the brain.
Yeah, so kids screaming and flickering lights, not a good combo for Jesse to go to sleep.
Exactly, yeah.
Cool. Yep. Anything else on that list? This is all really practical stuff.
I think having a good nighttime routine of, not having the phone at the bedside. A lot of the best sleep experts have great protocols on trying to limit phone exposure in the bed. Even if you are on your phone next to your bed, like if you have to do a text or send an email, get out of the bed and stand next to the bed to send that email. The less you can associate your bed with anything except for sex and sleep, the better.
Okay.
Because if you're sitting in bed and you're watching a TV or you're on your phone, your brain doesn't subconsciously know what to do when you get in bed anymore, right? Like if I gave you a high five and then handed you a cookie 100 times, every time I give you a high five, you're going to expect that cookie, right?
Yeah.
If you get in bed and you go to sleep and that's only what you do, that's what your brain's going to expect. But if I give you a high five and then give you a cookie, and then I give you a high five and I give you a prick to the knee, or a high five and something, you're not having a constant association, so your brain doesn't know what to do.
Yeah, I'll tell you, to be very humble and transparent, I used to use my phone less than, I don't know if this is proper grammar, than anyone I knew. Like I didn't go on social media, I didn't do anything. When I started this podcast, and when people were encouraging me to promote it on social media, I started using it more. And I started using it more, and I started using it more. And I got to this point, that's preface to say, where I had my phone next to my bed all the time.
Right.
And I developed this nasty connection to getting in my bed and just scrolling. And it wasn't even social media. It was like, what were the news of today? But I was using the phone to turn my brain off that day because it was moving too fast. And then when I tried to remove it and actually just sit in bed, it's like,
start going crazy.
Whoa.
Yeah.
Like I felt a powerful, connection to it. And it clearly the habit was overwhelming.
Yeah. And when I started getting into all the social media stuff, I have to use my phone more now. Unfortunately, I don't want to. I think it's negative in all aspects. And I developed that type of habit too. And it's been negatively impactful on my health. And so now I have to kind of combat that by forcing myself to even put my phone in another room.
Yeah. It's tough. And I heard an expression, I'm going to butcher it, but you don't know the power of an addiction or until you try to actually sever the chain. I don't know if I butchered that, but super practical stuff. I always like to ask, you got a lot going on, you're in your residency, you're exploring all these things, but if you had to kind of look out into 2026, what are you most excited about? And what's the future for Dr. Clay Moss?
I don't know. Right now I'm just trying to live day to day. I think it's fun to look ahead, but in past couple of years, I've had to constantly remind myself to just be grateful for every single day that I have now.
Amen.
So I don't want to look forward to anything. I just want to have the impact that I can have today. And I am very blessed to have so many different things and people in my life that a lot of people don't have. And so I just try to be thankful every day, because we're not around for that long,
Yeah.
So there's no point in looking forward to a year from now when you got this year.
Yeah, I love it. And I loved your answer earlier. It's like when I asked you, where are you going to land? What are you going to do? He's like, you just want to make a difference.
Right.
And I think you're going to make a huge difference, man.
Thank you, man.
Yeah.
Appreciate that.
Blessed to have you on the show.
It's fun.
Appreciate you.
Love it, man.
All right, Dr. Clay Moss.
Thanks, guys.
Wow, folks, what a conversation with Dr. Moss. One of the things that stuck out to me the most was the language he used around modern medicine, how it puts a, quote, Band-Aid on root problems, meaning it's not really addressing the issue. And that's a concept that is not unfamiliar to me, but just the way that he put it throughout our conversation, I thought really stuck with me, how we're treating symptoms instead of truly addressing what's needing and breaking down in our bodies. But the good news, as you heard in that conversation, is that we have the control. We can prevent a lot of the sicknesses that kill us as Americans. I love how, he talked about strength training. It's not just about looking good. or getting stronger even, it's the most powerful anti-aging and life extension tool that we have to use. So yes, you can look good and feel good, but you can do both of those things longer. And I love how he even compared strength training as something that can extend your life in an even more powerful way, that on the reverse side, that like something like cigarettes or unhealthy eating could shorten your lifespan, just meaning that it's powerful. And then, obviously, whenever you talk about strength training, you want to talk about nutrition. I loved how he talked about, intermittent fasting strategically, cutting out ultra processed foods, and of course, using supplements, but using them in an intelligent way to supplement a healthy, well-rounded, whole food-based diet. So just lots and lots of really good nuggets in there with my conversation with him. So I hope you got a lot from it. I'm so grateful for Dr. Moss coming on the show, for the folks at Purist Nutrition and Rep Fitness for hosting that conversation. We're looking forward into 2026. We've got a lot of awesome guests lined up that are going to be coming on the show. Just can't wait for that. So we'll wrap up with a big thank you. Thank you for listening to Stronger Weekly. Join us every single Tuesday for in-depth interviews like this one and deep dives on topics that matter the most for your health and fitness. As a reminder, every single Friday, check in with us again. We're right back here breaking down the weekly health and fitness news in a short bite-sized episode to give you the news and information you need so that you can grow stronger week by week. Don't forget to follow the show, leave us a rating and review, and share this episode with anyone who you think would enjoy it and find benefit from it. Hope you have a great week. Thank you so much for being here. Stay strong, and we will see you next time.